Good
Hello.
morning, everyone, and thank you for joining us this morning for another episode of Insights from the Couch. My name is Yalily Smith, owner of The Traveling Therapist, and I am joined by Dr. Anamaria Ryan, owner of Seven Counseling. And today's subject is one that I think everybody's going to be able to relate to, and that is how anxiety has literally turned into the disease of the 21st century. Um, I'm sure at some point in time you have been told that you have anxiety. I'm sure that at some point in time you've probably labeled yourself with anxiety. And so today we're actually going to venture into what is anxiety? What are the different types of anxiety? Where does it come from? And how can we possibly help manage our anxiety in a way that, we just bring a little bit more quality of life to our life. Welcome, Dr. Ana Maria. I'm going to let you go ahead and get started since this is a topic that you're very interested in. And I feel the same, but I feel like what you had to say was really good. So go ahead.
Thank you, Jalili. Always so grateful that you have me sharing this space with you so that we can reach some people, hopefully, and shine some light as needed in topics that are related to emotional and mental wellness. So, the reason why I thought this would be a good topic is because I have noticed a significant increase in my clientele that the main complaint is anxiety, generalized anxiety. So, part of the work that we do, I feel, as therapists, psychologists, mental health professionals, is psychoeducate people about what's going on. Your general practitioner may say something like, "Yeah, we think you have anxiety. This is the medication that we recommend, and if you want to see a therapist." But then from that point on, it's really up to us to explain to the person what is the nature of this. I guess I'm going to call it condition. But in a way, I mean, anxiety can be benign because it is a response for survival that is very much needed. If you didn't have that response, I think that we would be in trouble, right? Can you imagine being in the middle of the street, having a truck coming your way and not reacting? I don't think that's how it would be
I
so
agree.
great. So anxiety is needed in some respects, but what I'm noticing is that lately everyone is anxious. Everyone is worried about something. Everyone has a phobia. A lot of people are medicated. If it's not with a benzodiazepine like Xanax or Clonopin, it's with a beta blocker or other types of medications. So I feel that the reason why this is happening, there is a twofold situation here. I feel number one, a lot of us are bombarded with information constantly, and the human body and the human soul is not designed to handle that kind of interaction with constant information. So I think that the person that comes to your office and says, I am so worried about the current state of the world, or I'm worried about that this is going to happen with my rights. This is going to happen here with this group of people. Oh my God, the third world war is happening. It's because we are just bombarded with information that we probably don't need to be accessing at all times. So there is that part. And then there is the part that is more related to the chemicals in the body, because yes, anxiety is an emotional response but also has chemicals involved. And so that's what I wanted to tackle this morning. I don't know if you have noticed an increase of clients in the practice that you own that also come with complaints of anxiety and certain fears about the future, current situations. Most likely, the things that we worry about are not going to happen, but these things seem so present in this moment. And that's why people get so nervous. They hyperventilate, they don't sleep well. Some people have panic attacks. Some people have palpitations. So I was wondering if you also were seeing that in the traveling therapists in your clinic.
I N Definitely anxiety. I mean, that's almost like this like a standard. I feel like people come in and they talk about anxiety like it is just as common to feel anxiety as it is to breathe practically. It's like anything can cause anxiety and people just like immediately throw the label on it. Now, what I've noticed that I was very surprised with is anxiety that has morphed into obsessive compulsive disorder, uh, eating disorders, other and more like more extreme versions of anxiety that I have noticed an increase in. The fact that everybody says that they're anxious, again, it's such a thing that yes, absolutely. Um, but also now more than ever, I'm noticing people having, agoraphobia, OCD, food, eating disorders, things like that, due to
The anxiety.
anxiety that's just gotten out of control.
Okay, well, then the two of us are probably experiencing the same thing. And if there are therapists listening to us, they probably would agree. So I wanted to comment that back in the day when I got trained, the Diagnostic Manual for Mental Health was in the fourth edition. And back then, we were trained understanding what mood disorders are. And anxiety was considered a mood disorder because it entails the production of some chemicals. And those chemicals I wanted to mention are important to be aware of. So, those chemicals are going to be stemming from that survival response that people experience, and they are necessary in the right doses. But when you experience anxiety as a mood disorder per se, whatever anxiety that is, those chemicals are in overdrive. So how do we manage, how do we balance those chemicals? There are natural ways to do this. If we look at it from the standpoint of cognitive therapy, we can definitely try to challenge the thoughts that are causing this anxiety. That's kind of like the basic work that we do. So guys, what are you noticing? What is the quality of those thoughts that may be causing your fear? Am I not in control of a situation? Am I not feeling safe? Am I feeling in danger? And we can start with that. But understanding that if the chemicals related to anxiety are out of whack, your norepinephrine, your GABA, your adrenaline, then it's going to be really difficult to just handle things, changing the quality of the thoughts or meditating. So we need to establish a baseline knowing, okay, what is it? Is it more a mood chemical relationship with anxiety here, or is this more of a circumstantial type of anxiety happening?
Okay, so I actually wanted to go over some of the chemicals
Yes, please,
and
absolutely.
just a really simple description.
Absolutely.
Um, because one of the things that I did, for example, I was experiencing a lot of anxiety at one point in the last year. We had some major changes in the company, there was a lot of pressure. And the first thing that I did, I went to my primary doctor and had lab tests done to evaluate if I had an imbalance in any of these chemicals. It turned out that I didn't. I was fine in terms of chemical. It was more situational anxiety. And so then I knew, okay, yes, the meditation will help. Yes, more sauna will help. Yes, challenging the thoughts will help. But the first thing that I did was I did go to my doctor and I said, I would like to get my lab work done because here are the chemicals that could have been affecting me. My cortisol, which is the number one, right? So
Okay.
that's known as the stress hormone. And
Yes.
elevated levels of cortisol due to stress can contribute to feelings of anxiety. We have norepinephrine,
Yep.
which is linked to the fight or flight response and can increase anxiety when there's too much of it being created. Serotonin, of course, which is the complete opposite. So while cortisol and norepinephrine in high levels will cause anxiety, serotonin on low levels is commonly associated with anxiety and mood disorders. So you could either have too much of something, too little of the other. Like you mentioned, GABA,
Yeah.
GABA is the inhibit GABA is an inhibitory neurotransmitter. So low levels of this can lead to increased anxiety as it helps to calm the nervous system. So if you have too little of the GABA, which is gamma aminobutyric acid,
Mm,
commonly known as GABA,
GABA. Yeah.
GABA.
Thanks.
If you have too little of that, we have dopamine, of course, which is probably the one that most people understand. Imbalances in dopamine levels can also affect your mood and anxiety levels. Um, a little known one is glutamate, which is a neurotransmitter, and is involved in excitatory signaling in the brain. So basically, too much of it can lead to increase in anxiety because it tells your brain you're very, very excited. Like this is like very big news or very serious or very scary, or it's just kind of like whatever you're feeling, it makes it 10 times more serious. And then the final one, of course, is adrenaline, which is this hormone is released in response to stress, leading to increased heart rate and high alertness. And you will probably feel adrenaline when you're having like a panic attack and things like that. You're gonna definitely feel the symptoms.
So if I can piggyback on what you're saying, I feel like GABA is more associated with tension. Adrenaline definitely is when people are feeling panicky, if I'm not mistaken. And the cortisol has been associated with prolonged states of anxiety. So I just wanted to add that to what you were explaining. But yeah, understanding that anxiety is not just something that you're creating in your head at times. It stems really from that survival response that we have just is in on steroids at the moment, and that's why you feel like restless. Some of the symptoms that people sometimes come and tell me about are, insomnia, shortness of breath, hyperventilation, palpitations, the famous infamous panic attacks. If you folks haven't experienced one of those, is not fun. You basically feel like you're dying. You may show up at your emergency room and they will do all the testing and tell you you're fine. You can go home. Well, that's a panic attack. So, if we are aware that there's a chemical aspect to anxiety, we can tackle it from that standpoint. But also, what is contributing to those chemicals being imbalanced? If it is an imbalance, right? Is it the quantity and the quality of stuff that I'm consuming in terms of information? Is it that everyone is afraid of something happening, impending doom? Is it that I'm getting, sorry for saying this because I know a lot of people love to be plugged to the news, but am I watching news all the time? Am I receiving things on my feed, on my social media that are not really helping my quality of life in terms of fear?
Yeah,
So I
I
don't know if you have.
agree. I agree with that, because, for example, I did not have social media for, well, I mean, I have to have social media for my business, but I
Business
didn't actually visit a social media site for a long time. I used to just maybe just watch movies or watch like videos that were not related to social media type of stuff. And s- um in the last couple of months, I decided to download social media again, and I it's taken me longer to fall asleep. I am a lot more emotional because depending on the time of day, you can get kittens and puppies to World War III to babies being left in a car to die. Like, I mean, it just, you never know what you're gonna get as you're scrolling and the algorithm is trying to guess what's gonna keep you tuned in.
engage, yes.
Exactly. Like, you never know what you're gonna get. You can have a so many different levels of emotion all within like minutes of each other, from crying with joy and gratefulness to like it's just losing all faith in humanity to fear and terror of the future. I mean, it's so, and we're really not, I don't think we're made
No,
to cycle through emotions at such a speed. I believe that we're supposed to be able to respond to fight or flight situations in the moment, and we are made, we do have the capacity, the physiological capacity to respond to terror and to scary things and to frightening things, but we're not made to respond to them
all the
constantly
time. Yes.
and on a cycle within minutes of each other.
Well, the funny part is that, say that there's not a chemical imbalance. If that's not happening and it is circumstantial, you may still experience the symptoms because the quality of thoughts or your life experience may be causing for those chemicals to be acting the way they're supposed to, right? So, but what ends up happening, I think it's important to highlight this, is your body's response is the body doesn't know if you're being chased by a tiger or you're just watching too much TikToks about I don't know, whatever it's that brings you anxiety, financial circumstances in the world, in the country, and so it is the same response. You're absolutely correct. Now, from the standpoint of the therapist, what is it that we can do? I cannot prescribe people with medication. So, of course, referring to the professionals that can do that in the cases that are needed. But then, from the therapist standpoint, how do we help the clients? I think, kind of like validating, of course, the fear, but also challenging the thoughts. And that's important for you guys to do that are listening. You can do this yourself. Like identifying what is that I'm worried about? Is this actually currently happening right now, or is it a hypothetical situation? We can start with that. Then we can follow up with, is there anything that I can do about it or not? And then we can just make a plan if there is something that we feel like we can do anything about. So for example, okay, well, this is typical. I have this bill that I need to pay. I don't know when I'm gonna get the money. How am I gonna do this? But I know that I have this check coming in at the end of the week. That's a plan. That's something that you're gonna get a check at the end of the week. You're gonna pay this bill, no problem. And then the trick would be to try to change attention onto something else that is not related to the problem. Hopefully, we can do that by talking to other people, engaging in mindless entertainment. Not everything has to be mindfulness related. So those are little tricks to change the attention. But I think it is important to again highlight that you guys consciously have to disengage from the thought process at some point and not just dwell in the worry if there's nothing to do about it, which in most cases, a lot of the stuff, there's nothing to do about.
Okay, so I want to mention that one thing that I do as a therapist, and I recommend this to the patients, I recommend this to other therapists as well, is I educated myself as much as I possibly could on the areas that I had control over in terms of like, I cannot prescribe, but for example, I educated myself on what are vitamins and minerals and foods and beverages and all types of natural approaches that you can use to help your body calm down and go from the fight or flight state to the calm and stable state of mind. So I will typically do a quick review of what is the level of caffeine that the patient
Yes.
is,
Yep.
how much caffeine are you consuming, how much sleep, because sleep will definitely affect your anxiety level. um, but then I also talk to the patients about how often do you take a multivitamin. Multivitamins may not be the most effective, but at least it's something. It's better than nothing. How often are you
Right.
taking a multivitamin? Or even better, are you the type of person that targets specific areas, that actually takes your blood work seriously, and like maybe really does go and take different vitamins, like magnesium, like
Yep.
ashwagandha, like,
Mhm.
all these different things. So I review with the patient some possible options that they can have that are natural
Mhm.
to increase their resistance to anxiety and manage those chemical imbalances. Um, and then I tell the patient, I'm like, maybe you should, the next time you go see your doctor, you should discuss, hey, I'd like to start taking this. Is it okay? Or maybe, ask the nurse practitioner to give you like a just a very brief 15-minute meeting, like telehealth meeting or whatever, just to go over and make sure that there's not going to be anything that's going to affect you. Especially, I worry about people that are on blood thinners, for example. I do
Yep.
worry about, right? So I always recommend, like, hey, check in with your doctor first before you're going to start taking anything. But there's nothing wrong with supplements and supplementing your body appropriately so that you don't feel the effects of the imbalance as much.
Thank you, Jalili, for bringing that up. I think that I also have that in practice, asking my clients how much caffeine they're consuming. I am Colombian, and I used to live on coffee, but I have had to reduce my coffee intake because sometimes I notice that it makes anxiety worse in my case, right? Another thing that sometimes I go over with my clients, and maybe physical doctors could confirm that this is the case, but yes, physical activity, aerobic exercises, specifically like HIIT and CrossFit, they're wonderful for mood regulation. But when someone is having issues already with panic related stuff like heart rate, breathing, being overextended, feeling hot, or like the body temperature is very high, maybe that aerobic exercise wouldn't be the best thing to do. So if you're like a crossfitter, a runner, and you're having panic attacks, it would be a good idea to try to just slow down with that until you're feeling a little better in terms of anxiety symptoms, and go with something a little lighter like yoga or tai chi. So that's another thing. But I think you touched on a really good point, because a lot of us don't realize that we run on caffeine. I have seen, I'm not saying who, but I have seen some people. I'm so anxious, and they walk in the room with this monster drink. So, or do you think this might have something to do with the anxiety that you're experiencing? So, yeah, I think you're correct. Maybe just doing a little bit of research. What is it that you're consuming, or you could be potentially consuming, to help you decrease those symptoms? But in terms of the quality of thoughts, I do use something called the worry tree that I was kind of like explaining. Understanding, is this worry something that I can or cannot do something about? I think that we can start definitely there. So, for example, if you're worried about world finances, is that something that you specifically can do anything about? Most likely not. So we definitely need to shift the focus of attention mindfully onto something else. That again can be distraction, but I feel that at that point we really have to make that conscious effort. If you have something that you can do about the problem, the best thing to do is schedule it and try to again shift the focus of attention. Ruminating about this problems, this worries, is only going to make things worse. And
Yeah.
I think that's where a lot of people get stuck. At least a lot of my people. They're like, but what about this? Okay, well, can we do something about that? No, we cannot. Okay, well, why don't we talk about something different right now? That's technically what I do in some types of sessions. I try to shift the attention mindfully onto something else that has nothing to do with the worry. And I do that very purposely. It's not to diminish or minimize what the client is talking about. It's just to show that the mind is easily distractible. We don't have to sit with the problem, with the worry all the time, and caress it like it is my precious. I don't know if you have any tips or things that you do, interventions that you do with your clients, or you have your clinicians do with people when they are
Yeah.
presenting with anxious thoughts.
I cold, like cold exposure. So like taking a ice cube and rubbing
Yes.
it on your neck,
Mhm.
especially near the thyroid area and like your face, or dipping your face in cool water. Though, like even sometimes I tell people like, hey, just put your head in the freezer for like 2 seconds, and just breathe for a minute. Just try to slow your breathing as you're like the putting yourself in the ice, like in the like, cold air. So I like in the morning doing a cold shower, for example. I also very much like to focus on people's natural affinity. One thing that I will say is if you're naturally somebody who has addictive personality, typically don't recommend the distraction to be anything that can potentially cause you to become addicted. So I would rather your distraction be something like, take up crochet, take up drawing, take up maybe something creative, maybe making love letters or cards to family members, maybe calling people and just chatting and catching up for the day. Hey, I'm a little bit anxious. Let me just talk it through. Let me just chat with my friends. I haven't caught up with my parents all day or whatever. But doing something as a light walk around the neighborhood with your dog, do things that are not going to feed your addictive personality, if you have a propensity for addictive type of behaviors. Because if you distract yourself, and I'll say this personally, it's not that I have an addictive type of behavior, like personality myself, but I will say if you put a flipping phone in front of me, I will spend 4 hours on that phone. Whenever I'm anxious, I just can't stop doom scrolling. I just because and then in my mind it's like, well, I just want to get away. What are you getting away from? It's like you're not getting away from the problem. You're like, oh, but I'm not thinking about work. Yeah, but now you're thinking about a whole bunch of other problems. That's not getting away. That's the opposite.
Thank you for sharing that, Jalili. And actually, that's the idea came to me to talk about anxiety as a disease of the 21st century because we're so connected. And you're absolutely right. Maybe that's not a good coping skill. Thank you for sharing that about yourself. And I think a lot of us do that. I was also thinking. I think my marijuana clients, medical marijuana clients, may not like me right now for what I'm going to say. It's not that I'm against medical marijuana. It has good uses, of course. That's why it's regulated, but I have had a lot of experiences with clients that present with high anxiety and they do medical marijuana daily. And sometimes it's like there could be a relationship there that you don't understand in regards to your body with certain chemicals that is supposed to be calming you down, but is really not helping. So that's another comment that I had to make
That's
with
true.
your observation that the distraction doesn't have to be something that could cause dependency.
Yes, and
Um,
right, I didn't that's exactly right. Not so much addiction because you you may not be literally addicted to it, but yes, becoming dependent on the coping mechanism. Coping mechanisms are not supposed to make you dependent on them.
Mhm.
So
Right.
that's a thought in that area. So know yourself, know your habits, know your personality as much as you can, and be honest with yourself. Like this is not something that's going to be positive because it's just going to lead me down to something else. But instead, I can do this other thing. So we can, just kind of doing that little bit of um, how do you say it, like self assessment on that.
I think we would be less anxious if we were more present. So maybe a little bit of technology detox could help. I know some people may not like to walk barefoot, but that is a good practice to feel connected to the earth. Is something that I suggest to some people if they're comfortable with doing that. And if you have practices that you do that are spiritual in nature, or even, for emotional wellness, like breathing, meditating, make that a practice. I used the word practice before. I'm going to say it again. Make it a practice because what happens is when you need that skill, and those of us who have had panic attacks know this. It's not going to work. Once you get on that ride of the panic attack, you have to wait. It's kind of like a roller coaster. You have to wait for it to be over. And maybe the breathing exercises are not going to work that well if you don't practice every day. So I think a lot of us forget about the things that work for us to keep us anxiety free. We don't practice them anymore. It's okay. It's going to be all right. So that's another thought.
Yeah, I agree with you. I always tell my patients, I'm like, what do you think is more effective? If you learn how to fly the plane as you're literally taking off, or if you learn how to fly the plane before you actually get in the cockpit. Like, how do you wanna address the situation with experience because you've already practiced it multiple times, or do you want to just kind of learn it in the moment while you're hyperventilating and having a full blown panic attack and you can't really focus on what you're trying to do and you don't, the steps and the process, and so everything has a process. So, um Another thought also is I can never, ever, ever, ever emphasize this enough. Your thoughts are not fact. A person can have a thought, a person can even have a feeling. It does not automatically mean it's a fact. You don't have to act, you don't have to respond to every thought and every feeling. You can literally have an emotional response to watching something on TV, for example. You can have an emotional response to it, and then you can let it go. It's okay to say, like, well, that was, that's disturbing or that's upsetting, and then move on to the next thing. You don't necessarily have to dwell on it and sit with it. And like you were saying, Dr. Ana Maria, like marinate on it. Like it's not necessary. You can feel uncomfortable for the moment and then move on to the next thing, or have the experience and then keep going.
Perhaps a lot of people feel like they are prisoners to their thoughts, and we forget that we do have the capacity to go for that distraction or center or ground ourselves. We're not really slaves to the mind necessarily. So just remember that, guys. You do have some things that you can do to feel less anxious, more grounded, more present. So that's all I had.
Yeah, thank you so much, Dr. Ana Maria. I appreciate your insight. I hope that you guys, as the listeners, took something valuable from this, and hopefully it helps you with your own journey. And my final thought is, remember that labeling yourself is never a good idea. So labeling yourself as anxious, like, oh, I'm just an anxious person. You're not an anxious person. You experience anxiety. You may be experiencing a moment of stress that feels like anxiety. It does not necessarily need to be anxiety. Anxiety, like we were talking about, is a literal chemical imbalance in your brain, or a situational experience where you are extremely heightened. That does not necessarily translate to every single experience you have all day long. You may just be stressed. You may just be rushing. You may just be having a hard day. These things are normal. That's everyday life. So be careful when you label yourself.
And I'm sorry, I lied. I said that's all I had. So let me
That's
just
okay.
say one more thing and then I'll be done. This is a trick or a little tip for the people that are listening. Thank you, Jalili. You made a great point and it just reminded me of what I'm going to say. Please don't call it my anxiety. It's not yours. This is something very small, but that can have a great effect psychologically. Is the anxiety. It's not your anxiety. You're not going to be seen or identified by the anxiety. So, yes, the
Yeah.
anxiety, not my
Done.
anxiety.
Okay. Thank you so much, everybody. We hope that you enjoyed this podcast episode, and we will be seeing you guys soon on our next episode. I can't even tell you the topic yet because we haven't come up with it, but it will come and it will be exciting. So enjoy it, and we'll see you guys later. Have a great day. Bye bye.